This month, the FDA issued a recall of more than 11,000 bottles of the popular blood pressure medication chlorthalidone. The nationwide recall was due to a potential manufacturing issue that could affect how well the drug works. But patients still need to take their medication, so Dr. Sirisha Vidali, did I say that right?
That's correct.
She's from Honor Health. She's here to talk about the recall and answer some questions about what people should do next. Thanks for being here. Millions of Americans are on blood pressure medication. So if they happen to be on this medication in particular, what should they do?
Yeah, so chlorthalidone is a very commonly used blood pressure medication. It's a thiazide-like diuretic. We use it for heart failure, for high blood pressure, kidney disease, liver disease. The problem with the recall that happened is that there's a ability of the body to not absorb the medication as well as it should.
Right.
So it was not a toxicity issue of the manufacturing plant, so that's an important distinction. What does this mean for the patient? It means that your dose might not be giving the complete dose into your body, so you might be underdosing yourself.
Here's what I would worry about. If you, for example, I take a statin, I never look at the bottle. I just take it. I know I'm supposed to take that at night. Probably with the same with people who've been on blood pressure medication for years. So is that a concern of yours as a physician, that they may not hear this little segment today?
Yes, I do. I think what everybody should do is, if they know somebody that is on chlorthalidone, or if they are on chlorthalidone themselves, they should look at the lot number and the box number and reference it according to the website with the recall. If you are part of that, I would actually ask for a repeat prescription to be given to you.
And so when you're switching from one blood pressure medication to another, I know on some medications you're supposed to titrate down before you get off of that medication completely. What about this one, and what about blood pressure medications in general?
That's a great question, and I do believe that this is very important, that you should not abruptly stop this medication. Since it's not a toxicity issue, we can actually keep taking it until we find out whether yours was contaminated or not, but abruptly stopping it might have long-term consequences such as heart failure readmissions, high blood pressure, fluid retention. So I would say that if you have chlorthalidone, contact your provider and see what your next steps should be.
And do these medications work by just eliminating excess fluid in your body?
It works in two ways. Well, eliminating fluid is the primary target, so it is a diuretic property that does it, but it also lowers blood pressure through the kidneys as well.
Before you go, I wanted to ask you, because it certainly caught my attention. Earlier in the newscast, we had a story about the 16th measles case. This went through Terminal 4 at Sky Harbor a week or so ago. What raises my alarm is that 16 cases this year alone. For the past 30 years, we've only had one case per year.
This is an alarming amount of measles cases, and it does concern me as a physician, especially for the children, because they are not protected in a lot of different ways, and you don't know what you're touching when you're in the airport. So it is a huge concern of mine. Yeah.
Thank you for coming in today.
Thank you very much.
It's important information, maybe life-saving information, so if you're on that drug, please be aware.
Thank you. It's a pleasure.
Karibe.